Yes, yes. So, someone said ligament, sprain, then what else?
Muscular strains.
Muscle spasm.
Muscular strain,
Ma'am, soft tissue injuries
yes. What
are
Bursitis.
all sorts of contractile as well as
yes,
non-contractile tissues.
yes. Like what?
Um,
Contractile and non-contractile.
like muscles,
Like
muscle is a contractile tissue and ligament is a uh, it is a non-contractile tissue.
ligament and
Ligament is a non-contractile tissue and muscle is a contractile tissue. So injury to both of them include are included under soft tissue injuries.
okay. Yes, you are correct. Very good. You have divided into contractile and non-contractile. Anything else that comes under your non-contractile unit?
Ma'am, fascia.
Capsules.
Fascia.
Bursa.
Okay. Bursae. Very good. Then,
Joint capsule.
sorry,
Ma'am, joint capsule.
joint capsule. Yes, correct.
Tendons.
So yes, tendons. Very good. Very good. So your muscle, tendons, ligament, capsule, then bursae. All these are the soft tissues. Okay. So whenever there is an injury, you should be able to identify, as a physiotherapist, you should be able to identify what is the structure at fault. Okay, you should know the structure which is injured and what it could lead to, what functional impairment it will lead to, or what disability it will lead to. So, being a physiotherapist, you should be able to identify those structures so that once you know that yes, this particular structure is involved, you are able to give appropriate therapeutic modalities and exercises accordingly. Okay, that's why it is important to study about soft tissue injuries. I will just share the slide. So what we will be seeing, we will be seeing different structures that comes under soft tissue injury. Then what are the causes? What are the grades of injury? Then what are the clinical manifestation? What are the dysfunctions which occur due to soft tissue injury? And what are the different stages of healing? Okay, acute stage, subacute stage, and chronic stage. So, as someone has said, when there is involvement of your ligament, so it is termed as spring. When there is an involvement
Ma'am,
of your, yes,
ma'am, sorry to interrupt, but can you rotate the screen because it is very small. We can't see clearly.
is it fine now?
Yes, ma'am.
Yes. So if there is involvement of the ligament, it is strain. When there is involvement of your muscle or tendon, it is strain. So that can be the involvement can be a partial tear or it could be a complete rupture. Then in the tendon, when there is an injury of the tendon, it is called as tendinopathy. Now, depending upon what structure within the tendon it is affected, because the tendon itself it is covered with a sheath. Okay, there is synovial lining. So if the synovium is affected, if it is getting inflamed, it is called as tenovaginitis. Okay, or if there could be inflammation of the tendon itself. Okay, that is tendinopathy. or it could be not due to trauma, it could be a degenerative changes. Okay, so these are the different kind of injury that can take place in a tendon. Dislocation, what is dislocation? When the articulating surfaces of the joint, they are not in contact with each other. Okay, that is dislocation. And dislocation also leads to surrounding soft tissue